to learn about. So I can ramble on and on about all sorts of injuries and all sorts of things. So I can also tailor it a bit more than to what's relevant for you guys, which is related to computer-related issues too. And but I'd like to see if you have any specific things you want to learn about related to computer preventing issues, or if you have certain issues going on. And so, any ideas, any thoughts? Yes.
Is there a chart that tells me how tall I am and how tall the keyboard needs to be, where the mouse needs to be, how high my chair seat pan should be?
Yes.
So I can customize it.
Yes, there are charts, and I'll email it to Elsie. You'll have it.
All right, wonderful.
Having said that, though, actually, I'll come back to that. Anything else? Any specific things you want to learn about? Problems you're having?
Do you do chemicals and add-ons too?
I'm sorry, say again?
Do you do chemicals and additives also?
Chemicals?
I keep hearing ads for low testosterone
Yeah.
that causes belly fat, among other things.
Yeah.
Is that true?
Well, decrease in testosterone level is going to increase the amount of fat accumulation, because also it's going to cut down the amount of muscle mass. So, testosterone supplementation or growth hormone supplementation, a lot of this stuff has been around for quite a while now. I know this is kind of a different topic, but it's been around for a while. A lot of the Hollywood stars, a lot of them are on human growth hormone supplementation. So there are a lot of ads out there, oral form of taking testosterone and other things, don't work as well. Usually there's intramuscular stuff that's given. And legally, you have to go to your physician to get a prescription. And quite often the prescription has to go with hypogonadism, so a decrease in testosterone levels. And a physician has to monitor your free-floating testosterone levels to see where you're at and manage it. And again, most physicians don't know how to do that, and you don't want to just go to your primary care physician who doesn't know, and they probably will not even prescribe that. Same thing goes with growth hormone and stuff. I do know people who are on it and who have taken it. Starting, in fact, about 10, 12 years ago, I used to know a physical therapist who worked in a cardiac rehab place with another physician. And they were doing hormone replacement or supplementation therapies more as cardiac. And the cardiac surgeries have not worked. They were using supplementation as one of the means to get things under control. So it is something very specialized. And yes, it would cut down on belly fat or just general fat, improve muscle mass, all those things. Especially growth hormone is needed for regeneration and recuperation in the system. That's why a lot of the bodybuilders, a lot of the pro athletes, all these guys are on all these things because it makes you stronger, faster, and all the above and all those things.
Any negative effects?
When not managed properly, yes. I mean, if you take free or testosterone by itself and a physician knows what you're doing, meaning regular blood work and all these things, not necessarily. The only thing that's going to happen is it's going to shut down your own production of testosterone. But if it's already, starting about 15, 16, you're at your peak, and after that you hit your 20s, 30s, stuff is going down as it is. So at a certain point, the argument goes that, well, it's not there anyway, so what does it matter? It's not going to come back up. You just stay on it after that. So, but it does need to be managed, and if you do excess amounts, it's going to lead to problems also. Yeah.
When I bend my elbow, I get a couple fingers here to get a tingling sensation, and obviously when I move the mouse, it does that.
So the mouse work tends to activate that, make it worse for you. Okay. Anything else related to that? You have any neck problems, shoulder problems? Just the elbow. Okay. So I'll talk about those specific things also related to mouse work. Anything else?
How to treat your knees. My wife is doing ice packs when she comes home now.
Yeah. Okay. Temporary solution. Yeah. Knee injuries, problems?
No, just getting old, I guess.
Yeah.
What can we do to, prolong it?
Sure.
Before we have to.
Yeah. Hopefully not.
Okay.
Yeah. Yes.
Working with a laptop on your lap.
Yeah. Meaning, is it problematic? Is it good? Is it bad?
Yeah, is it problematic? from the standpoint of the battery as well as the neck.
Yeah, I mean, I've heard different things. In fact, there was some, I think, a recent study, and that had more to do with keeping cell phones in your pockets. You see, I do that too. It's not good, and and there's supposed to be negative effects from that. And I think there are a couple of studies. There's a lot of those data is coming out now as more and more people are using handheld devices and other things. Some of them probably apply to use of laptops on the lap too, but definitely from a posture biomechanics standpoint, yes. If I'm hanging out for X number of hours in this poor posture doing laptop work, it can cause problems from neck, shoulder-related issues, and definitely wrist-related problems too. Definitely, yeah. So I'll touch on that when I talk about mechanics and sitting and those type of things. It doesn't.
Well, I'll throw in the reason that I originally went to see you, and that is the length of time that we spend sitting at the computer at one time.
Oh yeah.
Which was detrimental to me.
Absolutely, absolutely.
Okay.
So what I'll do is I'll go through that and the common issues that I encounter and that I see patients for, whether related to computer-related issues or just prolonged sitting, and what to do, just some general ideas what you can do in terms of addressing whether it's the tingling in your fingers with excess mouse work or prolonged sitting as an LC's case and resulting in low back issues to, for that matter, even shoulder-related problems or even other type issues that can develop. So as I mentioned earlier, I work at St. Louis Hospital, and I've been doing physical therapy at St. Louis Hospital for over 10 years now. So in the outpatient department, so you get to see a variety of orthopedic and neurological problems. And you also get to see people who have had problems and who come in over a course of X number of years, who come back to the system, and certain things that are predisposing people to get into trouble. I do think sitting is a major contributor, prolonged sitting. And in fact, there was a recent study I was reading and it said, the recommended 30 to 60 minutes of exercise. It used to be every other day, and then it became 5 days a week, and then it was every day, right? It still doesn't make up for the 8 hours of sitting, what we do does not make up for that. So that has a huge impact on, I think, all sorts of issues, whether it's neck-related problems, arm-related, shoulder-related issues, nerve-related issues, as the gentleman was saying, for that matter, low back issues, all sorts of problems. So, and I treat, quite often I find the major issues with computer work and computer usage are neck pain, nerve impingement, disc-related problems, a lot of shoulder-related issues, and definitely you get a lot of carpal tunnel, foot. And quite often, I don't think it's just carpal tunnel. That's something very specific. Your median nerve is getting your pains are trapped in the space, you have certain symptoms. But I think it's a host of other things going on too. It's not just that nerve. It's everything that nerve is connected to up the chain. That's usually problematic. So that's why usually you'll have people wearing the wrist splints, they'll go through the rehab process, they do a lot of other things. And the problem doesn't quite get resolved. And quite often people end up having carpal tunnel release surgeries and different things. And I find even after the surgeries, people end up continue to have problems. Because up the chain, you have to look at the elbow, the shoulder, the neck, and just that prolonged sitting in those poor postures, it continues to affect that system. Okay? So the easiest and the simplest thing to do is don't sit for so long. Just get up and get moving. Yes?
The word sitting is the new smoking.
Yeah, I don't know. It could be the new smoking, yes. I mean, think about it. People have sedentary jobs. You do 8 hours a day. You sit in your car. You come back home. You sit on the couch, and essentially you're sitting bulk of the day. And so the activity level has gone down significantly. In addition to poor postures and being in poor positions, just general conditioning of the system starts to go down. You get deconditioned, circulation gets compromised. So that in itself will lead to all sorts of problems, whether in terms of recovery or just getting into trouble. And it doesn't always have to be one specific incident that did it. These are slow, chronic, degenerative issues. And this is the excessive wear and tear that takes place over time. Yes?
How about scoliosis? So many of us are hunched over from looking at monitors.
Absolutely, absolutely, yeah. So, and that's where the prolonged sitting comes into play. So, you know, if you sit for X number of hours, or a certain amount of time over the course of years, and you don't do something to reverse that process, you are going to get in trouble. So that, you know, the classic forward head posture, you start getting more and more rounded, will definitely start to develop over time. So the goal has to be to do things that reverse that process. You know, whether standing up and moving around, or laying down and doing things more geared towards extension, the opposite direction. Right? So the big one, as I was saying, I find is the neck, shoulder, arm-related issues. The second big issue that I find is the lack of mobility in the hips. Prolonged sitting resulting in hips getting stiffer and stiffer over time. So which leads to a lot of the low back issues, hip problems, all sorts of other things. But that's why you see quite often people, after a while, are getting stiffer and stiffer, they get more rounded. Whether it's what you said, the scoliotic or kyphotic changes, which is this rounding that takes place, or your hips are getting so stiff, and it starts to cause you to lean forward. And to overcompensate for that, you're having to lift your head up, and then starts to cause problems through the ear. So all those things start to cause problems, and so the ideal is, of course, reversing. You know, if you're doing everything in the forward position, you got to go back to the other way. Okay. Yes.
This is not necessarily computer related, but the effects of stress. I did visit my